You booked the appointment, but now you're sitting there, staring at the screen, wondering what exactly you are supposed to wear, or what you are even going to say. We are going to walk through the entire telehealth experience, step by step, so you know exactly what happens before you even log on. To get started, you only need 3 basic things: a reliable internet connection, a device with a camera, like your smartphone or laptop, and a private place to sit. Stripping away the mystery allows you to approach the start of therapy as a sequence of clear, predictable tasks. Before your session, you will complete some basic online intake paperwork. Think of it exactly like filling out forms at a new doctor's office. It covers your background and the specific reasons you reached out. Coping and healing counseling verifies your insurance before your first appointment even begins. You will know your exact copay amount in advance, ensuring there are no financial surprises. This graphic shows how that process looks for Georgia Medicaid patients using CareSource, AmeriGroup, or Peach State. As you can see, the out-of-pocket cost is typically $0. Next, you will receive an email containing a secure link for your video session. That link drops you into a HIPAA-compliant virtual room. That means the video call is fully encrypted, strictly private, and no one is recording it. Finding privacy for that call is entirely up to you. Your living room works, but so does your parked car, or even a quiet walk-in closet. Choose wherever you know you won't be interrupted. And there is absolutely no dress code. Show up in whatever makes you comfortable. Your therapist genuinely does not mind if you are wearing your pajamas. Handling these simple logistical steps beforehand clears away the external distractions. When the camera turns on, your only job is to focus on yourself. During the first 10 minutes, your therapist will take the lead. They will introduce themselves, explain how they work, and clearly outline the rules of patient confidentiality. Then they will ask what brought you to therapy. This is the moment people often overthink, worrying they need to present a perfectly constructed answer. You do not need to rehearse a speech. Simple, raw starting points are highly effective. Saying, "I've been feeling off," or "My anxiety is getting worse," gives your therapist exactly what they need to start guiding the conversation. In the middle of the session, the pressure to perform disappears. This is a collaborative conversation where you share only what you choose, and because there is no judgment, your brain can stop scanning for social threats. When your body recognizes this safety, the nervous system often releases the physical tension it has been holding. This is why many people find themselves crying. It is a biological sign of finally letting go. Alternatively, you might reach the end of the hour and feel nothing at all. First sessions can often feel anticlimactic, and that is a normal response while you are still building trust with your provider. Whatever emotion comes up, you will not shock your therapist. They are trained to navigate anger, deep shame, and grief. All of it is expected and welcome. In the last 10 minutes, your therapist will summarize what you discussed and check in on how you are feeling. They may suggest something to try before your next visit. This therapy homework is not a stressful assignment. It consists of gentle, personal observations to make throughout your week. Finally, before logging off, you will look at your calendars together and schedule your next weekly follow-up appointment. Success in this hour simply means showing up and speaking honestly. The therapist carries the professional burden of giving the session structure. When you close the laptop and the call ends, take a breath. You have officially completed the hardest part of the process. You may experience a wide range of reactions right after logging off. Some people feel a wave of relief, others feel physically drained, and many feel emotionally stirred up. This graph shows why that happens. You might experience a brief downward dip in how you feel because you are finally confronting issues you usually avoid. That temporary dip is the necessary starting point for a long, steady trend of lasting growth. If you log off worrying that you and your therapist didn't perfectly click, don't panic. The industry standard is to give the professional relationship 2 to 3 sessions to properly develop. If it still doesn't feel right after that trial period, coping and healing counseling has an internal process to seamlessly match you with another provider on their team. Now that you know exactly what to expect, take the final step. Go to chctherapy.com to request your appointment. Booking that appointment takes bravery, but the act itself is just a safe, guided conversation waiting for you to begin.